Hello guys, let's see about beta-lactam antibiotics today. So the mechanism of action here is these antibiotics bind to the penicillin binding protein on the cell wall of the bacteria. This inhibits the transpeptidase enzyme which is involved in the production of peptidoglycans. So this results in formation of cell wall deficient microbes and this causes the bacteria to swell up and die. So these drugs are bactericidal. Now coming to penicillin, penicillin has a beta-lactam ring fused with thiazolidine ring. We have natural penicillin which is penicillin G. We have three forms: sodium penicillin G, procaine penicillin and benzathine penicillin, of which benzathine penicillin has the longest acting, produces low levels of the antibiotic over a sustained period of 4 weeks. So the spectrum here is it is used against rheumatic fever prophylaxis, streptococcus, sniffles, leptospirosis, yaws, gas gangrene, rat bite fever, actinomycosis and meningococcus. And the characteristics of penicillin G is it is acid labile and it undergoes metabolism by rapid renal excretion, mainly by tubular secretion. So drugs like probenecid will increase the half-life of penicillin G, and it is narrow spectrum and resistance. Inherently, some bacteria is resistant to penicillin due to the deeper location of the penicillin binding protein, and acquired resistance is through penicillinase enzyme. And side effects of penicillin include hypersensitivity. Semi-synthetic penicillin, we have penicillin V, which is an acid stable form which can be taken orally. Next we have penicillinase resistant penicillin. We can have oral forms and also IV drugs, and these are active against penicillinase produced staphylococcus. Here also we have another exception which is methicillin resistant staphylococcus aureus. Here the mechanism of resistance is not due to the production of penicillinase enzyme but due to alteration of the penicillin binding protein which is encoded through a gene called MECA gene. So the drug of choice here is vancomycin. Coming to extended spectrum, we have aminopenicillin, we have amoxicillin and ampicillin. Amoxicillin is given TDS and it has better oral absorption. This has lesser incidence of diarrhea when compared to ampicillin, and it is active against H. pylori, listeria and Enterococcus faecalis. And then we have carboxypenicillin and uridopenicillin, of which uridopenicillin is more effective against gram-negative organisms like Pseudomonas and Klebsiella and Proteus. We have piperacillin, which is widely combined with an beta-lactamase inhibitor, which is tazobactam.